All right, let's dive into one of the most incredible journeys in all of nature, how a child develops. We're going to map out how they go from a world of just pure sensation to understanding really complex rules and emotions. So let's get started.
So this is really the core question, isn't it? This isn't just about a kid getting bigger. It's this profound story of how a whole person gets built, piece by piece, right from the inside out.
Okay, first things first. Let's get two crucial terms straight: growth and development. They sound similar, but they're very different. Growth is the physical stuff, getting taller, gaining weight, and it follows these predictable patterns, from head to toe and from the center of the body outwards. Development, on the other hand, that's all about getting more capable. It's about mastering new skills, everything from walking to thinking logically.
So, where does this all begin? Well, that first year of life is just a whirlwind of change, and it's all centered on two huge challenges: learning to trust the world around you and trying to make sense of everything using touch, sight, and sound.
Here's how all these big ideas fit together. A theorist named Erikson figured that when a baby's needs are met consistently, they build trust. Makes sense, right? At the same time, Piaget called this the sensory motor stage, which just means they learn everything through their senses. They're totally in their own little world, which is why their play is called solitary play. And all of this sensory exploring leads to this massive, mind-blowing cognitive leap: object permanence. It's the moment they realize that even when they can't see you, you still exist.
And while all this amazing brain work is happening, the physical growth is just explosive. An infant's weight literally triples in just 12 months. Think about that. It's the most rapid period of growth in a human's entire life.
But this rapid growth, well, it creates some pretty unique dangers. Because they're so top-heavy, an infant can actually drown in as little as 1 inch of water. By 6 months, they can roll over, which is why you can never, ever leave them unattended on something high like a changing table. And the ABCs of safe sleep are absolutely critical: alone, on their back, in a crib.
After that first year, these little infants transform into toddlers and preschoolers, and I like to call them the great explorers. This phase is all about being on the move, gaining independence, and just this powerful drive to interact with everything around them.
So now toddlers are fighting for autonomy. That classic "I can do it myself" phase. Then preschoolers build on that with initiative, where they start planning their own little games and activities. Cognitively, though, they're in what Piaget called the pre-operational stage. It's a world run by magical thinking, where their own perspective is literally the only one that exists.
Now, this is so important. Egocentrism doesn't mean they're selfish. It's a cognitive limitation. Their brain literally can't compute another person's point of view yet. It's why a toddler will hide by covering their own eyes. In their mind, if they can't see you, then there's no way you can see them.
And of course, this whole great explorer phase brings a whole new set of dangers. That drive to learn means everything goes in their mouth, which makes the risk of poisoning super high. And their height? It puts them right at car bumper level, in a total blind spot. This is the age where things like cabinet locks and helmets just become completely non-negotiable.
And then, around age 6 or 7, something absolutely incredible happens. The magical, egocentric world of the preschooler starts to fade, and it gives way to the dawn of logic.
This change leads to a huge cognitive milestone called conservation. Remember how a baby learned an object still exists even when it's hidden? Well, this is the next level. A preschooler will tell you that a tall, skinny glass has more water than a short, wide one. But a school-age child, they conserve the idea of volume in their head. They just get that the amount is the same. And this ability to think logically about real, concrete things is the hallmark of Piaget's concrete operational stage.
This new logical ability, it changes everything. It's what allows them to finally play cooperative games that have rules. Socially, they move into Erikson's stage of industry versus inferiority. And put simply, this is just the drive to be good at things: school, sports, making friends, and get that sense of accomplishment. They want to feel capable or industrious compared to their peers.
And this psychological insight is just critical. Because they can think logically now, because they understand cause and effect, school-age children need to be involved in what's happening to them, giving them choices, explaining what you're doing. That satisfies their need for control, which, believe it or not, can be even more important to them than the pain they might be feeling.
So, understanding this normal developmental path is absolutely crucial because it's what helps us recognize when things go critically wrong. Let's look at a few urgent alerts where a child's unique body is a major factor.
Think about this for a second. Just 1 millimeter of swelling, that's about the thickness of a credit card, can be enough to severely block a child's tiny airway. It's why respiratory problems in kids can go from bad to worse so incredibly fast.
This vulnerability makes it vital to know the difference between two major airway emergencies. Croup has that classic, unmistakable barking cough. Epiglottitis, on the other hand, is totally different. No cough, but lots of drooling and agitation. And the absolute #1 critical rule with suspected epiglottitis is do not examine the throat. It could cause the airway to slam shut completely.
Moving on to the GI system, here are two birth defects that can look similar but are critically different. With an omphalocele, the organs are in the middle and they're protected by a sac. But with gastroschisis, they're off to the side of the belly button and have no protective covering at all, which is a massive surgical emergency.
Two more quick GI red flags to lock into your brain. For Hirschsprung's disease, the classic sign is a newborn who doesn't pass their first stool, called meconium, within 48 hours. And for Intussusception, you're looking for the sudden onset of really bad pain and a very specific sign, a stool that looks like currant jelly.
So, okay, we've walked through the stages, we've seen some of the dangers. Let's just zoom out for a second. Across all these different ages, there's a set of universal principles that guides how we give compassionate, ethical, and safe care to kids.
What happens in that just tragic case where parents refuse life-saving care for their child? Well, there's a very clear mandatory protocol. You notify the provider, you alert social services, and the hospital may have to get a court order. The bottom line is this. In these situations, the child's safety and well-being always take priority. There's no gray area.
And what about assessing pain? I mean, you can't ask an infant to rate their pain on a scale of 1 to 10, right? Our tools have to adapt to their developmental stage. So for infants, we use something called the FLACC scale, where we observe their face and body language. For younger kids, we use the FACES scale. And finally, that numeric scale can be used once they're old enough to really grasp the concept.
So we end up right back where we started. The journey is just breathtakingly complex. From an infant who doesn't even know where their own body ends and the world begins, all the way to a school-age kid who's grappling with logic and rules. The challenge for any parent or teacher or caregiver is actually simple in theory, but so hard in practice. It's to see the world through their eyes at every single stage. So the real question is, can we adapt our care as quickly as they grow?